The rectal exam tells you a lot of information about the intestinal tract, and then the nasogastric intubation tells you a lot more information about the proximal intestinal tract. If you have a sour smell, the food has been stagnating, and you can confidently say there's like gastric emptying. If there's reflux, there's an excess in biliary fluid that's being produced, and it's unable to move through the intestine normally. This doesn't necessarily mean that it's a surgical obstruction, because ileus can cause this too. But if you get more than 4 liters of reflux, or if the reflux is continuing despite the being off feed and being treated, you have some sort of outflow obstruction. If you add to it the presence of severe colic signs, you're likely dealing with a small intestinal strangulation. If instead you have some systemic depression or a fever, you might be dealing with a functional ileus. We now have a great tool that gives us information up to 30 centimeters deep from the sides of the abdomen, and that's the ultrasound. The focused localized abdominal sonography of horses, also known as flash exam, has been developed to give a good overview of key areas that are potentially involved in a colic without requiring a lot of time or a lot of skill.